children and young people who experience homelessness. So I just want to set a little bit of context before we get into that conversation, because of course we're having this conversation in the context of the government, the federal government, having said they're going to develop a national housing and homelessness plan. So we're in the process of that plan development now. And this conversation is one part of the process that leads into that, and it's a process for the sector. So Homelessness Australia is the peak body of the homelessness sector nationally, and YFoundations, Trish can introduce in a bit, but is a peak body for youth homelessness. So it's really great to come together and have this conversation about what needs to happen to create an ideal service system. But just to clarify, this is a process that will inform our submission, the Homelessness Australia submission, as well as, you know, anyone who's participating is really welcome to take the information that we discussed today and use it to inform your own submission. So we want it to be dialogue among the sector. But we've also put the invitation out very broadly, so just flagging that people from government who are writing the actual plan may be participating in the event, and others from government as well. So it's a very broad conversation. Of course, people with lived experience have also been invited and really welcome and encouraged to participate in the discussion and lend your views to what's needed to end homelessness for children and young people. So I don't want to talk on and on, because what I want the process for this conversation to be is we'll hear from some experts talking about what in their view is needed to create an ideal service system for children and young people. And then we'll have about half the time thrown open to examine that, people to respond to that, add in anything that they think is missing, or comment on what's been presented. So without further ado, I'm going to hand over to Trish, who's the first of our speakers. I'm not going to do big introductions. I'll get you to introduce yourself, Trish, and then pass over to Catherine.
Just bear with me. I'm just going to share that kind of really good conversation with each other around this. And so we're not going to talk to you from slides. We're going to have the slides up there, but we'll probably have the conversation going on. Catherine and I actually did go to Parliament House last week and managed to meet up with David Pocock, Max Chandler Mather, and Minister Anne Ali as well. And David Pocock actually spoke about unaccompanied child and youth homelessness in the Senate the next day. So we were really fortunate we got that kind of outcome from that. So the first slide, hang on, is exactly what you just talked about, Kate. So I did do a slide for you, and sorry about that, we didn't have it up there. But today, I think it's really important to acknowledge the age cohorts that we're going to be talking about today. And because this is a national space, we're going to stick to a particular, these age cohorts is 10 to 17, and that is going to be unaccompanied children. And we'll be referring to that cohort as unaccompanied homeless children. Then 18 to 24 will have unaccompanied young people. So there's good reason to do this. The distinction between the 10 and 18 and the 18 and 24 is so important when we're advocating and working in a policy space, because children under 18 need something quite different. They need care, they need guidance, they need support, whereas the 18, 24-year-olds mostly need support to transition onto adulthood, and they need quite different things, and the service system is quite different to what we're talking about, how we want them to impact the service system on these different age cohorts. And we can talk about that further down the track. The legal definitions we know do vary across Australia. We know in New South Wales it's 16, it's under 16. In, I think, ACT, weirdly, it's under 12. But the rest of the states and territories, it is under 18, hence why we have adopted that age cohort as well. And the 10 to 18 is a very significant cohort for Catherine Robinson's research. It's consistent also with the World Health Organization definition of homelessness. Is that correct? We say World Health, or was it another one, Catherine?
I think you may have an older set of slides up on the screen, but certainly under the International Convention on the Rights of the Child, and, you know, yeah, it is also the case that it's a World Health Organization definition as well. So, and it just makes sense. It's internationally what a child is. In most states and territories, it's also the case. And it's also where our key institutions of child protection and youth justice and child and adolescent mental health are also working. So in Australia, regardless of what our states and territories are doing, our actual child and adolescent service system also works around the definition of under 18s.
Yeah. And I'm stealing your words here, actually, Kate, but I remember watching you talk about this. You said that Catherine had sort of, you know, really embedded this idea of the different age cohorts, and you can't conflate the two age cohorts together because their needs are so different. I think that's the important message here, is that we can't bring them together. So we need to be quite distinct. I really hope I'm not using the old slides.
I think you may be.
I think I might be as well. So why are we calling for a standalone child and youth homelessness strategy? Well, because we know unaccompanied children and young people are consistently overlooked. They're consistently overlooked in state and territory housing and homelessness plans. They're consistently overlooked in domestic and family violence plans, in any sort of mental health and other health plans. Unaccompanied children and young people are consistently missing out. The focus on housing that has been quite dominant in the last couple of months as well, and not just the last couple of months, but the focus on housing, it sort of has this policy distortion where it moves away from children and unaccompanied children and young people. The types of homelessness children and young people experience are different. It's, you know, they're quite couch surfing, severe overcrowding. Those types of homelessness are quite different to the adult cohorts. And children and young people don't have the same coping strategies and resources generally attributed to adults. And I'm going to let you talk to that one, Catherine.
Yeah, so even if whilst I'm talking, you want to try and bring up the other
That's
presentation.
What I'm trying to do.
Yeah. I shall hold the fort. I think the key thing to think about here is that historically, of course, we have talked about youth homelessness as covering really age 12 through to 24. And I've already seen some feedback popping up in the chat that actually we know that the needs of children under 16 are going to be different to those who are 17 and 18, and certainly different to those who are over 18. So look, there's obviously quite a spectrum of need. But again, historically, we have just referred to child and youth homelessness as youth homelessness. And the service system has been set up with that kind of language. And what we have here is an opportunity to, at minimum, at least distinguish, you know, again, acknowledging, of course, there's a raft of different needs across different age groups within what is defined as youth. We have at least, at minimum, the opportunity to distinguish unaccompanied homeless children as those who are under 18 from those who are 18 plus. And the value of doing this is about aligning child and adolescent service systems across the board. So we have a child and adolescent mental health system, we have a child protection system. Interestingly, when children get into trouble, they're suddenly called youth. So we have a youth justice system, even though the age range in many states and territories is 10 to 17 for that group too. So if we are wanting to think about, which is what we'll go on to talk about, developing multi-system and multi-agency responses to children and young people, we need to make sure that we're talking, I guess, across the right kinds of systems and the relevant systems. So as soon as you signal that, in fact, you are talking about unaccompanied homeless children, you are aligning that cohort with the rest of the child and adolescent service systems. Because indeed, we know that all of those other child and adolescent systems will be needed in a collaborative response to unaccompanied homeless children. So again, historically, homeless service system has come to refer to youth homelessness under SAP. services were set up for young people transitioning to independence. So back in the old days, when rentals for young people were still even an option, the idea under SAP was that with some reasonably short-term support, young people could be transitioned to live independently. The scenario for unaccompanied homeless children is obviously radically different. We are not looking to transition children to independence. We are trying to think about what are age-appropriate, developmentally appropriate responses for that younger age group, and really separating out unaccompanied homeless children from youth points to the specific needs that both those cohorts need. So it's not just about, I guess, drawing attention to unaccompanied homeless children as a cohort with standalone needs, but also likewise highlighting that young people have a different set of needs, and there's strong advocacy also needed to recognise that there's different asks, different needs for those young people who are now looking to belong and flourish in the adult space.
Mm. I've got the slide up. Sorry about that. I can't believe I did that. You dropped it into me this morning.
Totally seamless. Totally seamless. So I guess what I'm picking up on are some of the final dot points on the slide that's now in front of you, which is around that slippage that occurs when we refer to everybody under 24 as a youth. And kind of override the developmentally specific needs of children. What this results in is a system that drives towards the adultification of children. We push children in youth homelessness services towards adult independence in completely inappropriate ways. And in part, that is also because our homelessness service system has not been set up, funded, or regulated or legally authorised to provide age-appropriate care. So these are still outstanding issues that many of our services across Australia that do respond to child homelessness, there are ongoing debates and struggles about how effective they can be in doing that. But the key point is responses are different depending on the age of the child or young person. And we have scope in front of us to foreground the difference in those needs, and therefore what prevention and adequate responses would look like depending on which age cohort you have in mind. But to ride over the top of those under 18 through conflating their needs with those of young people transitioning to adulthood, it's time for that to stop, and we have a unique opportunity for our services to raise this through making submissions to the national plan to really point out that what we need are different responses for children.
Thanks, Catherine. I think what's important here and what we're trying to get across as well in our submission is that we know there's triggers that escalate children and young people into homelessness that are different to adults, and that's neglect, family dysfunction, lack of effective care, guardianship, family or state, guardian by state governments, homophobia, transphobia. But we also know the triggers can be similar: domestic and family violence, similar to adults, poverty, sexual violence, all the racism, all of those sorts of things can trigger as well. But I think what's key here as well is that unaccompanied children, young people, don't have the same resources as adults, regardless. They don't have the emotional and financial resources as adults have. So I think that's really important to get it across in submissions as well, that this is why it's quite distinct, why it's quite different as well. I think what I'd really like to have a conversation about is the focus. We want to focus on our submission is why do unaccompanied homeless children and young people consistently fall through the gaps? And I'll jump into the next slide. I use this slide to talk about what I feel like a young person or a child could be experiencing tonight. And this is exactly it. I've shown this to a number of people, and I've shown it to a number of young people with lived experience. And it's just a young person trying to get a bed tonight and asking a friend, do they have somewhere to, can I stay with you tonight? And the friend saying, oh, sorry, can't stay tonight. Have you got somewhere else to go? And the young person's thinking of all her options, and her options are she has to trade sex to be able to couch surf at someone's place. She knows that there's no bed for her at the shelter tonight if she tries to get one, because well, she might get one, but 1 and 2 unaccompanied children and young people get turned away from getting a crisis bed tonight. Or we know that it's not safe at home. Domestic and family violence is quite rife in this cohorts, both cohorts, unaccompanied children and unaccompanied young people. We know that it's a serious issue, but it's still not highlighted in the National Domestic and Family and Violence Plan. So I don't know if you want to sort of talk more on that, Catherine, but I think that whole issue around why do unaccompanied children and young people consistently slip through the gaps? It's a question I keep asking myself, and we do know logically, but why has it continued?
Well, I think this goes back to the point about what are understanding the unique drivers of unaccompanied child homelessness in particular, because access to affordable, or a lack of access to safe, affordable housing for adults is obviously a key driver of homelessness. For unaccompanied homeless children, it is a breakdown in family relationships. Children are unaccompanied by a parent or guardian, and that is the root cause of their homelessness. They are no longer able to live safely at home. So in terms of then thinking about what do adequate responses to that look like, you're looking in different parts of, in different systems for those responses and in different parts of the system. So this is why understanding the causes, the differences in causes of homelessness for children and young people is so critical, because in understanding those differences, we look for solutions in different places. But what has happened is, because the homelessness system by and large, again, is about supporting people to independently access safe, affordable housing, the unique developmental needs, particularly of unaccompanied homeless children, are not reflected in that. So the homelessness system, which children come into, again, has not traditionally and evenly across all states and territories in Australia been set up to respond in developmentally appropriate ways to presentations from children. Likewise, we also know, of course, that out-of-home care and child protection services offer a very, very limited response. So children, there will be a cohort of children who are able to access out-of-home care. There will be another cohort who continue to live at home in abuse. There will be children who die and commit suicide. And then there will be another group of children who access care in the youth justice system, and another cohort who access care in the homelessness system. So we know that there will not be space in out-of-home care for all those who need it. It's responding to a very small component of the population who may need care. And so multiple systems need to come together to also provide a response for children who will not receive care in that out-of-home care system. And that includes education, it includes mental health, and it includes homelessness services as well. So how children continue to fall through the gaps, though, is where those other parts of the service system are not recognising unaccompanied children as a standalone cohort in need. And again, that happens in the homelessness system, it happens in the domestic violence system, it happens in the mental health system, and so on. What we have now is an opportunity with the National Housing and Homelessness Plan to really raise the need for Australia to meet its obligations under the International Convention on the Rights of the Child to ensure safe and appropriate care for children. And to have leadership come out of the housing and homelessness sector to lead a coordinated response across multiple agencies to ensure these children stop slipping through the gaps.
There's this argument, and maybe it's not an argument, but we hear quite regularly, if a child hasn't got into out-of-home care by the time they're 12, they're not going to get in there, particularly, you know, there just isn't space for them. And there's an argument that they should be in out-of-home care, but there's no space for them. And there's something that they should come into the homelessness service, because youth homelessness service, because we can actually look after them better than out-of-home care. What would you see as, if we did include that in a national, in our submission for the National Housing and Homelessness Plan, is it about beefing up the out-of-home care system and improving that, or is it beyond? Is it further than that? Is it prevention before they hit out-of-home care, or is it both?
I think it's all of those things, because prevention would take the pressure off all child and adolescent service systems, including out-of-home care, including the homelessness system as well. But again, there will always be children who are not going to be able to access the out-of-home care system. The homelessness sector is already responding to these children. And in fact, the limits in the out-of-home care system are so acute that that system is placing children who are on orders into the homelessness system. So absolutely, prevention is key, and this is why a national housing and homelessness plan that can drive coordination across agencies is so critical, because and why a standalone plan focusing on children and young people's needs is so critical, because we need a linked up response and investment in child, youth and family services, alongside investment in housing homelessness services at minimum at the same time. So I don't think we're suggesting a housing and homelessness response to this cohort alone. We're centrally seeing children and youth services as critical to prevention in particular, because we don't want them to turn up ideally in the homelessness system.
Yeah,
but we need to have capacity where they do, because they are. And again, just remembering that out-of-home care response is a tiny fragment of a response to children who experience abuse and neglect. Those children will continue to present to homelessness services. And there were also contexts in which many of those children, they will never be assessed as at the extraordinarily high threshold needed to enter out-of-home care, but they are not able to return home. And so the homelessness sector needs to work in collaboration with child protection. This needs to be a joint response. It can't be, not coordinated or isolated from each other.
And it needs more funding. I mean, that's a bit of a call cry, I know, but it does need more funding. And there's an expectation that youth homelessness services, take on these children with for the 10th of the cost of what they get in out-of-home care. So I think that's important as well. I think what's also interesting is your research that you did do on children who didn't have a child protection order, but couldn't access services because they didn't have a guardian or a parent to take them to. And could you just talk about the outcomes of those children? Because this is a particular cohort as well, which is quite outstanding that not outstanding, but it's quite concerning that there is a cohort that exists like that can't get access to mental health services.
That's right. Look, all of the unaccompanied homeless children who've participated in my research and all of the services who have also participated and shared their expertise. These are all, the key issue that everyone is pointing to is that these are children who cannot return home. So the children participating in my work have all experienced very significant exposure to domestic violence, abuse, neglect, and then cumulative trajectories of violence and abuse and assault subsequent to leaving their home environment. These are children who do not receive child protection or out-of-home care response, and then surviving on the margins of a homelessness system that in general is also not set up to respond to them. So that involves them in couch surfing, rough sleeping, and so on. But of course, because they are under 18, there's obviously a lot that children need assistance with, and they're just simply not able to do as children because they have no income, because they have no transport, because they have no Medicare card, and on it goes. And in particular, some recent work that I've done around unaccompanied homeless children's access to mental health services. Clearly, even accessing a GP to get a mental health plan, accessing any kind of specialist mental health care, accessing state-provided CAM, so child and adolescent mental health services, in Tasmania at least, and I've heard that this is very similar in other states and territories, you need a supporting guardian to advocate for your access into those services in the first place, and you also need a guardian to accompany you to those appointments. You will not be seen otherwise. And given what unaccompanied homeless children have survived, they are certainly not able to access low-need services such as Headspace. So we have a critical gap for unaccompanied homeless children around moderate to severe mental health services. So, you know, this is why we're talking not just about system gaps in the homelessness sector, but right across the child and adolescent service system for children who are unaccompanied by a parent or guardian.
This is a good segue into your research that you've done here, where it's this triangle, and it's sort of the ideal service system where the pointy end is the intensive responses. And so that the universal responses is obviously prevention, not early intervention. Targeted responses is probably more like early intervention. And that's what we'd like to see. And this is kind of the structure we've always been trying to sort of, communicate to in our submissions and governments and things like that, that the pointy end just needs to be that, just a pointy end. Did you want to talk to that one, Catherine?
Yeah, sure. And I think Trish is going to post up some links to some just really kind of short articles. Sorry if you've already done that. I can't keep an eye on everything all at the same time. But just to say, if you're having trouble reading this, you can also access it in the short article that Trish will post up a link to, or someone in her team. So really, when we're thinking about how do we stop unaccompanied child homelessness happening, this is about setting up a system that is focused on prevention. And so what I've used here is a public health informed approach, which looks at what do we need for mainstream universal responses that would do really early work identifying and preventing children from becoming homeless in the first place, right through to recognising that, of course, some children nonetheless will. And so what then do good responses start to look like? So again, it's absolutely not the case that we'd be suggesting that out-of-home care is not a viable option for children in their circumstance. And indeed, what we're looking for is a greater interface between child homelessness services and out-of-home care services in that long-term intensive response end of things. But certainly, of course, prevention starts much earlier. And in the recent work on unaccompanied homeless children and mental health that I conducted, children were identifying to me that they were first becoming really clearly aware, for example, of poor mental health related to trauma at home by year 3. So they were starting to articulate very significant issues for themselves from year 3 onwards, and feeling mentally unwell at that early age. So when we're thinking about universal responses, often these are targeted to high schools. But in fact, we know that these need to be happening much, much earlier. Of course, child and family health services, but then primary schools. If we're starting to do early homelessness identification in high school, we are way out of step with what it is that children are experiencing. And this is what I see across systems in general. There is a real misalignment with what we understand children to be experiencing and what they actually are experiencing. And this flows into children's experiences of intimate partner violence as well. Children are having intimate sexual relationships. Children experience intimate partner violence. And so alongside homelessness responses, we'd be expecting to see responses that are really focused on prevention around intimate partner violence. And that is, you know, safe relationships, education, for example. But again, needs to go way further than that because these children are in significant relationships. So they're just some examples of some of the kind of targeted responses that we'd be wanting to see. And in particular, relationship-based outreach is just so significant as a tool. And this is why, you know, I said earlier, responses to this cohort sit across child, youth, and family services and housing and homelessness services. So under universal and targeted responses, you see much greater presence of child, youth and family services. Acknowledging that if we can keep children at home, identify them early because they're starting to present with mental health issues or intimate partner violence in their own sexual relationships, and again, the role of targeted outreach that is long-term. So in Tasmania, we have a fantastic service called the Targeted Youth Support Service. They're able to work with children for 2+ years. That is the kind of response that is needed in this space. As we know, though, children, for all the reasons we've discussed, are falling through the gaps. They continue to accumulate subsequent experiences of harm. So intensive responses then come into the field of view. And really the key here is thinking about what does adolescent service coordination look like? And really making sure children have access to trauma recovery services. And of course, at that point, also receiving or have access to dedicated residential services because they are not going to return home. So again, what this diagram's showing is a kind of a service continuum that moves from child and family services and then much more strongly into housing and homelessness and out-of-home care services. With the idea being that significant investment at the front end will lead to fewer children funneling through to long-term intensive non-statutory residential care and or statutory residential care.
And that's going to be a really important trying to communicate that message to the federal government in the submissions that we do. I think, you know, we've been talking about, it's not like it's a new idea. We've been talking about this for many years, but trying to be really clear in our submission about, you know, putting in the universal services before it does become a long intensive response and how important that is. And hopefully we're still in the draft phase of our submission that we're writing, but I'm really working hard to try and make that clear about in certainly how you've done this triangle and showing that service continuum as well.
And I think it's really important to be encouraging not just SHS services to be informing the development of the National Housing and Homelessness Plan. I think outreach services, child and youth and family outreach services have a really critical role to play here in terms of speaking up about the crucial role that they're playing in earlier intervention. and in stopping or reducing the escalation of children within homelessness, youth justice, and out-of-home care services. So we really need to be hearing the voices of those services who are working alongside children at risk of experiencing homelessness unaccompanied by a parent or guardian, as well as those services who are currently have those children as their clients in an ongoing capacity.
Yeah, I mean, it's so multifaceted. It's going to be tricky communicating this. But anyway, I won't keep talking. But in terms of, I'm just talking about like the homelessness responses that we will be calling for. And this is more youth, not unaccompanied children. Some of them, as you know, would be unaccompanied children because of the age cohort. But this is not the service continuum. This is more choice. When the child or young person becomes homeless, or some of it is before that happens. So we know we need an increase in crisis beds. We know that young people turn up 1 and 2, one will only get the bed. So we do need that increase for that urgent situation today, that those children and young people have somewhere safe to stay. We know we need an increase in crisis accommodation from exit options from crisis accommodation, such as transitional. Have that for 2 to 5 years. That's transitional housing plus. That's what's in New South Wales. For 5 years, it really gives the young person the capacity to get on their feet. If you give them that 5-year period to engage with education and employment, I know that YFoundations, our sister organisation, which is the community housing, youth community housing organisation in New South Wales, which is the only one at the moment in Australia, but there'll be more coming on board. I don't know if I'm supposed to say anything about that or not. Also, to what we seem to have a lot of difficulty with trying to encourage ministers and bureaucrats is that we need more responses, dedicated responses to children and young people who are experiencing domestic and family violence. We just can't seem to get any traction in this space. I call on you to go and look at the National Domestic and Family Violence Plan that exists. They do talk about children and young people in their own right. They don't actually give that a definition. So we don't know if it's unaccompanied children and young people. So again, I think the action plans have come out recently. We'll have to have a look at those and see what is in there for unaccompanied children and young people. Not a whole lot, I can imagine. So we really do need to be pushing this space as well, because we do know that the children and young people come to our services. Anecdotally, we're hearing 80 to 95% are escaping family and domestic violence. The SH data is not reflecting that, because it's not what they don't actually reveal that as soon as they come into the service. It takes some time for the child or young person to reveal it. We're also calling for more social and affordable housing. More affordable and social housing for young people. Historically, young people do not get access as oops, there's someone there. They don't quarantine social housing for young people. They rarely quarantine it, is what I mean. Sorry. So if you look at the SHS data, I think there's something like 45% seek social housing or affordable housing. About 3% get it. More FOIA models, we could do with more of those. Also better early intervention models like the communities of schools and services. And that's the early intervention model that you were talking about, Catherine, where you do identify high school children and young people in high schools at the moment, not primary school. You're saying it should really be extended to primary school, but it is a sort of population base within the school program where they do a survey and identify if a child or young person is at risk, and then bring in support. If so, improved out-of-home care responses, I won't go on because we've talked a lot about that already, and improve exits for young people from out-of-home care and youth justice, and better access to mental health services. We don't have all the answers on that yet, or the complete set of service responses that we would be calling for, but this is just the start at the moment. Unless you want to say anything to that, Catherine.
I think the only other thing to add into there is to just recognise that there's also a cohort of older young people who will continue to need support, which, just to highlight that, you know, it is there on the slide, but alongside foyers, which have traditionally been for young people experiencing lower support needs, it'd be great to see the system strengthened for those who have higher support needs. And certainly services in Tasmania are really kind of reporting this as a priority. I guess, again, just making sure that the lived reality of young people's lives is reflected in the service system on offer to them.
Yeah.
The need for continued outreach and support for older young people who have complex needs, who may be starting to live independently. So it's not just about providing the housing, it's also about providing models of mobile support for older young people with complex needs too.
Which is consistent with the housing first approach, which we don't need any more evidence to prove that's as a successful model. So just wrapping that support around with the housing. So this is, and there's both of us, Catherine and I have talked quite a bit about this, and I'll kind of give it a bit of a background in terms of I still think it's quite unclear and a little bit vague in the issues paper about what is the plan going to achieve. And it's said, I think it says something like it'll guide the policy development of the states and territories, and also the federal policy development as well. But I think, you know, you wouldn't be Robinson Crusoe if you were underwhelmed by the issues paper. And it's difficult to think that that will be, you know, that's part of the resources that is going to guide policy. So we've done a lot of talking about what should the National Housing and Homelessness Plan be. And then we're going to talk about what should the National Housing and Homelessness Agreement be. So we think, because the plan doesn't have any authorizations or mechanisms in there that require the federal government, the state and territory governments to do stuff, that's in the agreement. I think we agree that it's in the National Housing and Homelessness Agreement, and that's where the teeth is. But we don't think the teeth is in the plan. So what should it be? What role should it play? So we're sort of talking about it should be the strategic vision and expectation for multi-agency accountability to prevent and respond to homelessness for unaccompanied homeless children and young people. And it should be the strategic vision as well about what is good or best practice that responses for unaccompanied children and young people, not just that. So that's where we're talking about that broader suite of services, or that prevention and early intervention where other agencies have a responsibility. So we see the plan as being that as well for unaccompanied children and young people.
And Trish, just to jump in, that's to say that unless there is federal vision of unaccompanied homeless children and young people, there will be no drive across those federal agencies for increased investment in the different areas of service provision that will be needed.
Yeah.
Hence the need for a plan, a national plan, and a standalone plan which foregrounds children and young people.
Which we haven't touched on as much as what we normally do, but we are definitely calling for a standalone unaccompanied child and homelessness plan when we're in our submission. It's one of the key asks that we have. And we also think there should be a distinction between the federal and state government responsibilities, because then that can help us sort of figure out who can do what, who has the resources that can be channeled into this particular issue. But we can talk about that a little bit more down the track. This is what we were talking about with the NHAR. we think in any of your submissions, because they haven't really touched on it yet, we know there's going to be a new NHA by the end of June 2024, but we're going to, in our submission, and we're hoping others are going to be calling for this as well, that any vision in the plan must be clearly identify the NAHA to explicitly name unaccompanied homeless children as priority cohort, because young people are already in there. It requires locally nuanced action plans, state and territory ones, to prevent and respond to homelessness. But when I say those plans, I think what's really important is that we actually have to be clear there's dedicated resources, because this could be a bit slippery where states and territory governments could actually pull together what they're already doing for what they think they're doing for child and youth homelessness. And it's almost like a framework of what already exists, and there would be no dedicated resources. So I think that's really important, that the agreement is actually channeling that responsibility down, or that requirement down. That, you know, new resources need to be channeled into that. And then we also think it has to have targets and reporting measures on homelessness for unaccompanied homeless children, and that's tied to the provision of federal funding. So they're sort of what we talk about. I was talking about as the authorising mechanisms before. Everything it has to be tied to, and that includes the agencies that exist beyond the specialist homeless services that we've talked quite a bit about this morning, that need to be responsible as well. Catherine, did you want to have anything to say there?
Yeah, I just think for those who are thinking about putting a submission in, obviously in different parts of Australia and in different services, there will be key issues coming up for you that we haven't touched on. So this is not an exhaustive account of everything that needs to be thought of. But I think what is critical is that those of you working with unaccompanied homeless children and young people who are homeless, making sure you really talk about the raft of needs that they have across different areas of their lives. That is what is critical here. It's getting an adequate vision of the range of needs that these cohorts have, that in turn sets up and gives and evidences the need for a multi-agency response. So again, talking about the education, health, mental health, justice, as well as care and housing, independent housing needs across that range of children to young people is critical. Because what we're asking for then is, because that range of needs is so diverse, this is why we need a standalone federal plan, because we need someone to champion those needs across all of those relevant federal agencies, which we know will be required to successfully prevent and respond to unaccompanied child and youth homelessness. The answer to these children's and young people's homelessness will not come from homelessness agencies alone. So unless we document children and young people's needs broadly, talk about what you're seeing in your clients, for example, that will be critical and supports the need for that overarching vision to be championed at a federal level. This is why we need a standalone plan, because children's needs are not being met across the board, and we need a vision of response and prevention to be led by someone, or we'll just have the same situation that we have now, that we had 30 years ago, as documented by Brian Burdekin in the Our Homeless Children report in the 90s, early 90s. Instead, we've got an opportunity for change here. So documenting all areas where that change is needed in, for me, that's what's critical here.
I'd like to ask Kate this question, if you don't mind, Kate, if I throw you something. What we've just been talking about to the multi-agency response, and, the breadth of, the service continuum. We know, having been in the sector for many years, both of, and many people who are on this call, there's been a number of attempts to do that. And I know in one attempt where it felt like it was just bringing together the agencies to have a bit of a talk fest, or, a brains trust. But to actually get that requirement in, the real requirement where there is a response to unaccompanied children and young people within agencies, what do you think is the best way of doing that?
Yeah, great question. Thanks, Trish. And I think just to sort of take a step back, and a really useful explanation about, what needs to be in the plan, but I'll just maybe explain a little bit more about what's the difference between the national plan and then the NHHA is the National Housing and Homelessness Agreement. So a plan has the opportunity to bring different levels of government together by setting setting targets, for example. So if a national plan, which the National Housing and Homelessness Plan will be a plan of the federal government, but also of the state government. So it has the opportunity to say, okay, well, we know we've got this many unaccompanied homeless children in 2023. Our objective is to halve that in 5 years. So we're going to look across all of the reasons that young people are becoming homeless, and children and young people are becoming homeless, and seek to reduce those numbers by improving the situations. I mean, if we can see why children and young people are becoming homeless, we can see what's needed to be done to address that, which, as each of you have flagged, is not always just about what is happening in homeless services. It's often about what's happening in terms of the kind of outreach supports that are available to help families who are really struggling. So government in the plan could then articulate, okay, we're going to have an action plan that relates to strengthening families, and then we're going to measure what the outcomes of that are over a period of time. So I think it's about the national plan. The key thing is about the opportunity in the national plan to set targets and measure success against those targets with some identified measures. And we have a really amazing set of data with the Australian Institute for Health and Welfare Specialist Homelessness Services data, which, for all of you who are running, working in homelessness services, is compiled from the information that you put in when you're working with clients. So that's all then aggregated up into these national statistics. So we can actually see children and young people are coming to homeless services. Here's the issues that they're presenting with, and seek to change that over time. I mean, I think that's the kind of ultimate objective. But of course, we also, in the national plan, need to be talking about what given that we can see in the statistics that we've got children coming to us with this set of needs, well, what are homeless services able to respond to in terms of meeting those needs, and what's the set of services that's needed? And that's where the National Housing and Homelessness Agreement comes in, because that's where the federal funding to the states, and where the federal and state governments have an agreement and are each contributing resources to solve these problems. So the point is that the national plan is where we can set objectives and measuring and processes that review and then refine over time. The National Housing and Homelessness Agreement, having a priority set in there for responding to unaccompanied homeless children, guides where the funding is allocated. So they're connected, but they're slightly different in that way.
That's interesting, because I would have thought the targets and the measures would be in the agreement, not the plan. No?
Well, they possibly would appear in both, but the National Housing and Homelessness Agreement is just one way that you would you would respond to those targets, because it only guides the homelessness service funding. So if you, for example, had a target that you want to reduce the number of children coming to homeless services as a consequence of neglect in the home, then you're not responding to neglect in family environments in the homelessness service system. There's a whole child and family services system that provides, or is intended to provide, I think generally doesn't provide. There's huge gaps in terms of the amount of support that families who are struggling are able to get to better manage a challenging family environment. So that's where you'd sort of put resources, and so that would be an objective in the plan, but the resources would be in a different agreement.
So, Kath, I'm going to throw this to Catherine. I'm just on the back of what you said about the AIHW data. It's difficult for unaccompanied children, young people, because, well, it's data that is collected about demand, and if a child or young person knows the service exists and if they can actually access the service, and then also too, like the domestic and family violence is the data is a bit skewed there as well, as I mentioned. So I'm just thinking, is there better data sources we could be looking at? Certainly the SHS and certainly the census, but is there other good sets of data that people could be looking at for their submissions, Catherine?
Look, it is really tricky. And I think for a national strategy, I do think the AIHW data is absolutely our best go-to. They have not been regularly reporting the statistics for children presenting alone. I think the increasing momentum around this cohort is starting to challenge that. I think the number of data requests that many of us have made to AIHW about specifically reporting not just on children and young people, but on children presenting alone specifically. And also changing the age, the way they break up the age reporting. So I always ask for data for presenting age 10 to 17. And I do that. So that's obviously for my focus on unaccompanied homeless children. And I do that because children report in my research that they begin leaving home at age 10. And so straight away then, if that's the case, you see the problem more broadly with the AIHW data, which is about demand, as you've said. Really, it's just about reflecting the quality and reach of the service system and the age limits on services, which have traditionally actually been 13 plus in Tasmania, and in some states are 16 plus. So if children are becoming homeless at 10, they're absolutely not going to be appearing in IHW data. So that's the kind of, the dangerous, I would suggest, visibility gaps of that data, which is why learning from services with their expertise on the ground and is just so critical. And again, thinking more broadly than just SHS services as well, what can be learned through what it is that child, youth and family services are seeing too.
I thank you, Catherine. Kate, should we throw to some questions? Is there any questions there? Because Catherine and I promised we wouldn't talk more than half an hour, but we've just talked for an hour and 3 minutes, so I apologise. But I think there's probably some questions in the chat, is there?
There's some questions in the chat, but I just wonder if people want to flag and then ask the question verbally. So if you just put your hand up, which I think you can do if you click on the reactions, but there's a thing there to raise your hand and then you can speak up. So Naomi, did you want to ask a question?
Hi, thanks so much for sharing that. Like, it's mind-boggling. I'm not in the homelessness sector. I'm Red Cross Emergency Services. And since the 2022 floods, we our team in the Northern Rivers have been supporting a lot of flood displaced people, and some of those people are children and young people. Yeah, and I was just wondering, with the research backgrounds you have, is there a lot of material that I could look into as far as rough sleeping and homelessness, preparedness, emergency preparedness for, obviously disasters make vulnerable people even more vulnerable. Yeah, so that's my question. Is there best practice, or is there somewhere you can point me for homelessness disaster preparedness?
Sure, I can jump in and answer that. Really happy if you want to contact me by direct email, and I'll put that in the chat. Lots of states and territories have disaster preparedness plans specifically for homeless populations. So there's lots of examples floating around of plans already written. However, and I'm sure you all know what I'm going to say here, in terms of how nuanced those plans are for unaccompanied homeless children and young people, I don't think we're near to that. In fact, in Tasmania, we don't even have a disaster preparedness plan, full stop. There's still a long way to go, but there certainly are examples. But I think this is a good reminder to be also thinking about, in the context of emergencies, how well seen are unaccompanied homeless children as a standalone cohort in need, and young people. And of course, during COVID, this was brought to the fore in a very brutal way, where it was immediately apparent that unaccompanied homeless children in particular were invisible to public health services, and even in terms of homelessness COVID responses and recovery, they were absolutely missed for the large part there, despite obviously having very unique needs and not being accompanied by a parent or guardian. So yeah, that's also something to be thinking about in your work too, Naomi.
Thank you. Thanks, Catherine.
And I just Naomi, we did some regional forums last year in Homelessness Week, and what we were hearing from services is that unaccompanied children and young people, weren't giving priority as families or single mothers escaping DV, and they were given tents in some instances to that was all they could provide them at the time. So, it is one of those cases where unaccompanied children, young people are low down in the queue when there is an emergency like that. And we understand that, but it's also, we're not, my motto is that I'm not accepting that anymore going forward. Unaccompanied children, young people should be up there as a priority with all the other priority groups as well.
Absolutely.
And again, this is why a national plan is so critical, because raising the visibility of unaccompanied homeless children and young people is needed across all areas. And in a context in which we're only going to see increased impacts from climate change, awareness of the specific developmentally appropriate needs of these children, including in contexts of crisis and disaster, is only going to be more needed, unfortunately, in particular because of then the disproportionate impacts of disasters on those cohorts which experience the highest vulnerability.
Yeah, absolutely. Look, we go and do outreach in emergency accommodation, and sometimes through commonly known rough sleeping areas. And I find those young people that are falling through the gaps, and link them as best I can. But as far as like disaster preparedness, I work specifically in Byron Shire, which is, I think it's topping Sydney's rough sleeping numbers. I just want to do my best in that space. Anyway, I'll email you. Thanks so much, Catherine.
I think Catherine, you raised a really good point just then about a lot of the work that we are going to be doing in our submission is actually encouraging government to understand the issue better and raise this profile a lot better than what it is now. I mean, that's probably going to be 3/4 of our submission. Is just like, these are the issues that we're consistently falling through the gaps, consistently not identified as a priority cohort. The issues of unaccompanied children and young people are just not raised in the plans. And we were talking about that when you go and look at national plans, the DV, Domestic Family Violence Plan, the housing, any state and territory housing and homelessness plans, unaccompanied children and young people are rarely in there. Unaccompanied children not in there at all, but young people are rarely in there as well. And we talked about a third one, that was the child protection one. Did we?
The protecting Australia's children, I think it's called. Yeah.
But we're just talking about, it's inadequate, the response or the identification of unaccompanied children and young people in those plans. So a big part of our work is actually trying to encourage visibility around this issue as well in our submission.
Yeah.
I can't see the chat, unfortunately. I don't know where it's gone.
So look, there's people I can see that I know from all around the country working in different youth homelessness or youth services. So it's not just about questions. Also, if you think that there's anything that you're working on that is really important for people to include in their submissions to the National Housing and Homelessness Plan that you think hasn't been addressed, please speak up. And likewise, if you've a lived experience of being a young person or child who's experienced homelessness and you think, but they just haven't talked about something that's really important to me, please also speak up. Narelle, over to you. You just need to unmute.
Sorry. Hi, everybody. Thanks very much for those presentations. That's really helpful. I guess there's not enough time today, though, to discuss some of the things I think may be a bit controversial or a bit sensitive, and that we do need to explore them properly. I'm extremely worried about the approach to out-of-home care not being adequate to meeting the needs of the children who need out-of-home care, and therefore the homelessness system might have to expand itself to address that. I think that needs a discussion, that there is not enough time, so I'd ask that we find a time to do that. I think the other one that is problematic, not that I disagree with it, but it is about the multi-agency accountability. My fear of that is what will happen when we did the previous plans and the previous strategies, and I'm talking mainly about New South Wales and nationally, is that sometimes that becomes so convoluted and so complicated that all it does is cause a whole lot of meetings and reporting and data and no friggin' action. And so my fear is that we might be asking for something that in fact, the caution is always be careful what you ask for. So I actually think that requires another discussion, that we can look at what happened before, where it went wrong, and what we could put in there to make sure that doesn't happen. Because there's been numerous attempts at this, and we don't want to then distort it by having all these other agencies involved and having the time and effort of ours going into that for little gain for the children and young people. So I actually think that requires a whole other discussion. And the other one that I would say really carefully is about the homelessness system and the money. There is not going to be a whole lot of extra money. Yes, there may be some, and yes, we should always ask. And as you know, I've got a history of lobbying and fighting for that. So I'm not saying we don't do it, but we need to be making sure we don't prevent or find a way that the states and territories get out of what is their responsibility for children and child protection and out-of-home care. And I believe they would be cheering hearing some of this today, because they'll see a way through it. So we need to have a discussion about the boundaries and things we say about that. So again, we don't ask for something that in fact comes back to us and it's a disaster. So it's not that I disagree with all the things Catherine and Kate and Trish have said. I think there is a further discussion to be had to remedy some of the barriers, because I think it could be pie in the sky and could actually cause some problems.
I'll respond to that. And Kate, it sounds like you're going to respond to it as well. First off, when we were talking about the multi-agency responses, we were talking about making sure that any plan, any submission we do actually recognises all the other agencies that are responsible for preventing child and youth homelessness. So it's not about the homelessness sector responding to that. It's actually making it very visible and very clear that if that doesn't work well, it's going to trigger children and young people into homelessness. So I don't think we were actually saying that. And so we won't hear the cheers from other agencies and states and territories, I don't think, Narelle, because we wanted to just have the submission to be clear around that. The out-of-home care stuff, again, it's one of those things that, unfortunately, and Catherine can talk to this more, is that when they do say child, if they haven't got into out-of-home care at 12, they don't generally make it. But our services are telling, I know a lot of my members are telling me they have these children in their services. So it's about getting, I don't know, it's about responding to everyone's needs. And I certainly would not want to divert the responsibilities of agencies to the homelessness service sector. We certainly wouldn't do that. And the other, anyway, so I'll let you go, Kate.
I think it's always a challenge in homeless services because people become homeless because all of these other systems fail. And so the question then is, do we respond to every failing in the homelessness service system, or do we push back to the other service systems and say you have to do a better job so that less people who are coming through your service system end up in a homelessness service system? And I think it's part of the challenge of talking through sort of expressing correctly what we're trying to say, so that it's clear that what we're not saying is that we want committees led by the homelessness service system that attempt to respond to every issue. It's that we want government agencies that are responsible, for example, for the mental health service system, to be clear that provision of effective adolescent mental health services and mental health services to adults who are parents means that the issues that happen in families that result in child and youth homelessness will not occur. So it's about those areas of government endeavour taking responsibility for their work so that they don't push people to homeless services. And that's where it's about leadership from government in the plan and processes that can lead responses in the plan, not about, I know what you mean, Narelle, about those committees at a local area level, which can be useful in some instances, but can't be the panacea to every problem, that we just have service coordination and not additional services to respond.
Which is what I raised about having that experience of all of those committees, and it didn't work unless there's actually really clear mechanisms with teeth in them to make sure that those agencies do the work that they're supposed to do. That's what we were saying, rather than, we weren't suggesting that the homelessness service system was going to do that.
But other comments, really useful to have that insight. There was something I noticed in the chat, which I think is a really important issue. I'm not sure, Rebecca, if you want to talk to this more, about gaps in the NDIS then resulting in homelessness services. And I remember being in a discussion about housing options for children coming out of home care, and hearing that whilst children with intellectual disability in previous times might have at 18, if they're coming out of home care, had a place in a residential service for adults with an intellectual disability. Because of the way the NDIS works now, those services are not available, and so people are being exited in that circumstance just to homeless services. So that's just sort of one example, but Rebecca's raising the issue of people who are going to need long-term NDIS housing and are waiting for a place and are sitting at that point with homeless services.
Yeah, hi, thanks, Kate. Where this feedback comes from predominantly is our work on the mid-north coast. We're in partnership with CHL up there, and we have a team member who works in their office in basically the access and demand function. Someone walks in off the street, they're homeless or looking for some kind of service. There is no DCJ office on the mid-north coast anymore. They were part of the social housing management transfer, one of those regions where DCJ completely exited the system. And we are consistently, my staff consistently struggling with young people arriving who have an NDIS plan or should have an NDIS plan, much like the should be in out-of-home care but aren't. And finding somewhere for these people to live while they wait for long-term social housing is really difficult. Yes, we can provide it in very limited circumstances. However, if we're providing it as a youth services provider, we would then need to be relying on an adult provider to take that tenancy over when they kind of age out of place for us. Should they have to deal with that level of instability? I'm not sure that they should. And so, yeah, they're just, I often talk about how most young people won't need a lifetime of social housing if they're given the right interventions and the right amount of time in terms of support and housing and opportunities being facilitated. But there certainly is a cohort that are young that are going to need lifetime social housing, and there's no excuse for them to continually be ignored by the long-term social housing system. But it's what happens. They just can't get in. So yeah, that's what that point was about. My staff are constantly bringing it to me, and their endless level of frustration of trying to provide a service to these people.
Thanks for that.
Thanks.
Any other anyone else want to jump in? There's, I think, I can see people from a few states who we haven't heard from, and particularly speak up if you've got particular issues from a rural or remote area or Northern Territory, Western Australia.
Just as a crisis service provider, I guess would just really like to see an end to these young people just doing the 6 month, the 3 month placement. And no one's touched on today that you have to be 16 3/4 to sign a lease. So when we're looking at those longer term social housing options, they're just not even possible for the cohort we're really talking about. So I think we really need more medium to longer term options for these young people that don't rely on social housing. So I don't know if that's more medium long-term refuges where a young person, once they're stabilised in a 3 months, say at the girls' refuge, then there's the next house where you move to for up to 2 years. You get to finish your schooling, you get to be with people that you've built a connection with over time. I mean, we're paying the same amount of money if we're putting them in one refuge or the other, so let's just try and keep hold of them rather than kicking them out every 3 months. It's horrific. Anyway.
Yeah, Cindy, I did put that in like my list of responses. I just didn't explicitly say that, stop, expecting young people to jump into, different refuges every 3 months. So I did have the exit options from crisis, which was transitional housing plus and medium-term housing as well. So I did have that in a previous presentation, the detail about the issue of the refuge hopping, but I just took it out of this one. But yeah, definitely it'll be in the submission.
And then obviously the support that sort of sits alongside that housing needs to be age appropriate. So obviously that would look quite different for someone who's 15 to 18 to someone who's 18 to 24. And I think I can't imagine if you're younger than 15 that you know that would be an appropriate option. That would need to be something quite different again. But I think maybe now what I'll do is talk a little bit more about writing submissions, because one of the things that we wanted to really encourage was as many people as possible to write submissions and to not feel sort of daunted by the process. I mean, what we've wanted to do today is explore a whole range of the issues that you might want to touch on in a submission on child and youth homelessness, unaccompanied child and youth homelessness. But you don't have to touch on all of those issues to write a submission. A really good submission, I think, combines what you know really well and communicates that clearly. So, for example, if you're working in a refuge and what you see is this issue of children, young people staying for 3 months and then having to move to a different refuge and build a whole new set of relationships and stay for another 3 months, and then move again. And you can see how damaging that is. And even at the end of that, oftentimes, imagine we really struggle to find a long-term housing option that meets the needs of that young person. Then that's what you can talk about. And I think in a good submission, often if you express the problem, this is what we see as the problem, and then this is what we see would address that problem, then that of itself, even if it's over just a couple of pages, is a decent submission. You just need to talk to what you know. And then if you're writing a bigger, or you want to sort of touch all of the bases, then you can sort of draw on more of the content that we've heard about today. And I've put a link to the paper that Catherine wrote in the chat, and we can send out some materials after that would give you some more resources as well. Of course, the slides will be available, and then there's some other articles and materials being written. And Homelessness Australia has also written a guide to writing submissions, which talks about a bigger, across not just child and youth homelessness, but across sort of all cohorts, about describing to government what's needed in prevention so that we have less people coming to homeless services, and then what's the different elements of what's needed in response. But again, I really encourage you to use that resource, but at the same time, you don't have to cover off all of those elements. If what you think it's important for government to hear is some examples of what's going wrong that you see in your work, or if you're someone who's been homeless yourself, then what do you see as would have helped you better when you came to homeless services? Does anyone, just before we close, want to jump in with any last points? Shall I just say then? Oh, no, you, Trish?
Oh, sorry, I was just going to say, we have a separate webinar consultation for YFoundations members on Wednesday morning, by the way. So, yeah.
So maybe we send out to everyone who registered for this, we can include a link to that. I think will be useful. I no doubt you've already promoted it to your members, Trish. So a big thank you to Trish and Catherine for that presentation. That was really fantastic, and really appreciate all of the effort that went into putting that together. And thank you so much to everyone for participating. Your input was really useful, and yeah, it's really fantastic to just see such a big group come together to talk about such an important issue. And so the next step will be to tell the government about everything they need to hear, so that in 5 years we've had a big impact on child and youth homelessness. I think that's the number one thing. If you're sitting down to write a submission, tell government what would it take to really make a difference so that we have less child and youth homelessness, and so that we're meeting children's needs when they come to us.
And thank you for hosting us as well. doing it.
Yeah, thanks to Homelessness Australia. Thanks, Kate. Thanks, Trish. And lovely to have some time with you all.
Thanks, Catherine. All right. Woo. 1 minute
Thanks,
off.
everyone.
You're 1 minute back in your life. See ya.
See you, folks.